This is an emergency news flash here, and a story that they kind of tried to hide from the people. And it says the D.C. dunce, the Trump administration is proposing changes to Social Security that could terminate disability payments to hundreds of thousands of Americans, particularly older people and children. The new rule would change aspects of disability reviews, the methods by which the Social Security Administration determines whether a person continues to qualify for benefits. Few recipients are aware of this proposal, which is open for public comment through January. Critics of the plan liken it to the administration's efforts to cut food stamps, among other entitlement programs, with insufficient information offered to explain curtailing benefits. Social Security officials declined to comment. For years, Republicans have argued that Social Security benefits need to be reined in to save money. The new rule advocates for low-income Americans, say it's just a way to push people off disability rolls. Now, serious concerns about this proposed rule, said Senator Bob Casey of Pennsylvania, added that it appears to be yet another attempt by the Trump administration to make it more difficult for people with disability to receive benefits. In a similar vein, U.S. Representative Brenda Boyle, a Northeast Philadelphia Democrat, said these changes seem arbitrary, concocted with no evidence or data to justify such consequential modifications. This seems like the next iteration of the Trump administration's continued efforts to gut Social Security benefits. Typically, Americans who are too physically or mentally impaired to work may be eligible for one or two kinds of benefits: Social Security Disability Insurance, that's SSDI, and Supplemental Security Income, SSI. While SSDI is for people who have worked for at least 10 years, SSI is for low-income recipients who have seldom, if ever, been employed. More than 16 million Americans receive either SSDI or SSI benefits, and merely getting benefits is an extraordinarily difficult task, often taking years and requiring applicants to compile reams of documents, then state and restate their cases in front of hearing officers, adjusters, and judges. Explaining the proposed rule change, Kathleen Ramage, senior policy analyst and Social Security expert at the Center for Budget and Policy Priorities, a left-leaning project nonprofit in Washington, said parts of what's happening here are mystifying and is very complicated. The new rule is the government trying to kick out of SSI, said Jerron Johnson, 34 years old, a single mother with 3 children, 2 of them on SSI, and Johnson, who is bipolar and suffers, also is on SSI. What they're doing is wrong and making life harder. Those already receiving disability benefits are subject to so-called continuing disability reviews, which determine whether they are still deserving of compensation for an injury, illness, or other incapacitating problem as their lives progress. So, this is what's going on right now. Typically, 50 to 65 years of age in poor health, without much education or many job skills, they often suffer from maladies such as debilitating back pain, depression, herniated disc, or schizophrenia. The inclusion of Step 5 people in the medically improvement likely category appears to make little sense, advocates for the recipients say. Medical conditions generally deteriorate as already unhealthy people age, and no evidence exists that such beneficiaries are likely to improve. Labeling them that way is a radical departure from past practice, she said. There's no medical or scientific basis to say that they'll get better. Compelling Step 5 recipients to be reviewed every 2 years shows a hostility toward the basic Social Security Act, which takes a holistic view of the individual. He said he believes the ultimate aim of the rule is to review Step 5 recipients so often that they ultimately lose their benefits because of the difficulties compiling with the review process and complying with the review process. There's an underhandedness to this. It's ideological. not based on medicine or science. They're out to shrink the rolls, and they're setting up people to not comply. So asked about the appearance of taking benefits from vulnerable Americans in the election season, Lang said, I don't think they care about the optics very much. They're focused on saving money, and they're planning on doing whatever they can to eliminate hundreds of thousands of disabled people from the Social Security rolls. So this is something that, you know, you need to really try to get in contact with your congressmen and your senators and your local politicians and get busy, because there anybody out there with a disability or you have relatives that are disabled and receive Social Security benefits on that level, get ready, because your president is talking about getting rid of, basically eliminating SSI disability and any kind of Social Security disability benefits, and making it so difficult for you to get them that it would be almost impossible. So they haven't actually passed this yet, but this is what they're working on, and they're talking about doing it by next month, by January. Say, you know, this is a proposal. So get busy, start writing those letters, and you got to come up with a petition. Got to come up with a petition or something quick before the DC dunce destroys your lifestyle.